Hello, my friends. How are you today? And welcome to our meeting, ABCs of Part 3 MRCOG. After the brilliant result that you have achieved in Part 2, so I would like to congratulate you guys. Okay, and this is the time that we start together the journey of the Part 3. For the Part 3, you should know some of the information, basic information before you start on preparation, so you will start right. Okay, I have received so many questions about the Part 3 preparation, and the big question is whether shall I go for May exam or shall I go for November exam? Okay, so what are the resources? How to prepare? Is it important to have a study partner or not? And what about recalls? What are the recommended books or resources to study? So in this meeting, I'm trying to answer all of your queries, my friend, and I'm so glad to help you through. It's me, Dr. Rabah Abdul, and I'm one of the mentors of the eMRCOG online sessions. Please, my friends, go with me, okay, one by one. And here I would welcome you to the circuit of the Part 3. What is this? This is your exam circuit, as it should be. This is the circuit of the Part 3 examination, which consists of 14 tasks. Each task lasts for 10 minutes exactly, and 2 minutes for the preparation. In one day, if you have the exam, for example, okay, at the 10th of May at morning time, you guys at each floor of the RCOG building, if you are sitting the exam in the UK, will have at each floor, you will have one circuit, and the circuit consists of 14 doctors. Each one of you will start here, for example, at number 4, and one will start at 5, and so on, and then you will start to move after hearing the bell. Okay, so time management is very important, okay? And my friends, you need to prepare very well for that day. Why? Because the 14 task had no break in between, right? And you will constantly speaking to a role player or speaking to an examiner, right? Or speaking to one of your junior colleague in teaching stations, for example. So you have to have confidence, okay? Nerve control and time management. So let's see more about the Part 3 exam. Part 3 exam, it's all about the application of clinical knowledge. Some people say that the Part 3, no need for knowledge. You've been tested already in Part 2. And I'm sorry to say, this is not correct. Okay? The base knowledge for Part 2 is essential for you to pass Part 3. However, they don't ask you for the theoretical knowledge, they ask you for the application of knowledge. So I always say in that day, you are required to act as a doctor for 3 minutes in the RCOG hospital. At one task, you are required to be in the antenatal clinic counseling one patient who just have detected a congenital anomaly in her child at the 20-week scan. In the next station, you are congratulating a lady who had just been, discovered that she is pregnant, okay, after IVF, for example, and 5 years of treatment for fertility. In the other patient, you will have angry husband, okay, because his wife, for example, came and waited for a long time in the triage unit and nobody have seen her. And so, okay? So situation awareness, your ability, okay, to act as if you are in a real scenario. This is the highest form of assessment, and this is the highest form to test your ability, okay, to work under stress and to show how safe doctors you are and to apply your knowledge along with securing the communication with the patient and communication with the colleagues. Okay, so the first question to start with is May or November. Okay, this is the first question or the most common question that I have received. Simply, my friend, is it possible to pass if you have the exam in May or if you have the exam of November? Yes, it's simply, yes, you can pass, guys, in May, for example, or you can pass in November. So less than 3 months can be enough for part 3. For some people, yes. Okay, but not for all. And let me say, the most important thing is you only can tell me if you are ready for May or not. How? Number one, if you have a spare time to practice every day, I don't want you to miss one day without practice at all for the part 3. If you have a study partner, a dedicated study partner that can help you and practice with you every day so you can apply what you study. If you have experience with the UK system, for example, okay, does this mean that only people with experience inside the UK can pass in short time? No. Okay, and we have proofs. We have, the feedback from our candidates who passed in 2021, 2022, 2023 in 2.5 months only for the preparation, but they were dedicated, hard workers. They had time, they had a study partner, they had also experience in other exams similar to that one, the OSCE exam of the UK. Like, for example, people who have cleared their MRCPI or people who have set the PLAB exam before, right? So you only can answer, do I have time? Yes or no. Do I have a study partner? Yes or no. Why study partner important? I'll come to it. It's very important that you have a study group or a study partner so you can practice some, you will perform and listen, okay, to others as well and give feedback. So it's very important way of learning, right? And preparation for the part 3. It's very important to speak out. If you are that person who's shy to speak out, if you are that person who's, not feeling comfortable to open the mic and share opinion or practice cases, that means you will take longer in the preparation. Okay, so please just sit for like few minutes with a clear mind and answer those questions, okay, to yourself. If you feel comfortable to sit the exam for May, go for it. Or otherwise, take your time in the preparation and appear with confidence in November, right? November is not very, very far actually. So it's like how many months? Okay, like 8 months and a half, something like that. Okay, till you get the November exam. But don't let yourself a long time without studying, especially if you passed part 2 fresh. So in order to keep the knowledge, in order, to stay updated, you have to prepare yourself and start from today. Okay, so whether you are going for May, whether you are going for November, you have to start today. Okay, don't wait. Believe me, will be critical. Every day we do have updates. Every day we have articles released. Every day we have a change of the recommendation. So you have to be, always updated, and you have to be standby ready, okay, for the exam. So good luck, my friends, whatever your choice was. What else do I need here to cover with you guys? I'll tell you. My dear friends, can you see here? This is an example of a study partner or study group. Why it's important? Again, because part 3, it's all about performance. Part 3, it's all about speaking out. Okay, so if you're not feeling confident to speak out in front of audience or in front of other people, examiner and assessor, okay, you will not pass this exam. even if you do have all the necessary knowledge, okay? So you have to show it. How to gain practice on that? Simply by practice with a study partner, okay? Some people, when they feel struggle to find a study partner at the beginning, they start practicing in front of a mirror. Some will practice in front of a laptop, okay, or a mobile camera, and they record themselves, okay, and then they watch themselves and they give themselves a feedback. Some people, maybe they create a private channel on the Telegram, for example, and they start to record the voice for themselves and then listen to it again. All are ideas, you know, to help you speak out. But my friends, nothing replaces a dedicated study partner. And a good study partner should first speak the same language as you. Mother tongue is the same. Secondly, okay, better to have joined the same course as you. Whatever course it is, okay, it's better that you have a study partner from the same group, or at least listening to the same mentor, okay? So you both together will be in the same line, you know? This is one thing. Another thing is, your study partner should be that person who give positive comments. I'm not saying nicely, and they say, oh, you did well, very well, without really offering any help in the feedback or criticizing your performance or guide you to your mistakes. No, but some people are really, you know, judgmental, and it's hard to practice with them. So choose a person where you feel comfortable with. And to be honest, a little bit of a tip, okay? Why people would like you to be their study partner: if they see that you are enthusiastic, if they see that you are a hard worker, if they see that you're really, you know, knowing your target and you're working for your target every day, so people will be attracted to you, you know, to practice with you. So guys, speak out and take it a chance. You can join our free group, for example, and practice speak, okay, and receive a feedback. That's a very important to show yourself and to gain confidence and to find a suitable study partner. You might even have a study group. So that's mean if somebody who is, for example, busy at on call or busy with family circumstances, you will find the other person and so on. Okay, so make it a very good experience, okay, and choose a good study partner. Study partner can help you, my friends, and can push you on those days when you feel down or you feel that you're not able to continue on the practice, because we all feel the same. We all get those moments when we feel down. I feel like, oh my God, I can't do anything today, okay? Or it's too difficult, or no, I'm so far from achieving this. No, my friends, believe me, okay? Study partner, a good study partner can help you in that, okay? And a good mentor as well can help you in that, of course. So let's see, my friends, the resources to study, or what shall I do? Some people for the part 3, they go in depth with the theory, which I really say, please don't, okay? I advise you not to do that. Shall I read TUG articles? I'll tell you. Recent TUG articles, you have to read them, okay? Why? Because if I am an examiner and I'm writing a case or a task for the part 3 exam, from where shall I get the idea? Okay, I will search about something updated and new, something trendy. Okay, so you will find the recent update of a guideline, or you find the recent released TUG article, especially last 2 years. Okay, so for part 3, I'll tell you, focus on the last 2 years TUG articles, read them. Okay, just read. Shall I go and read all the guidelines again, summarize the guidelines, and, you know, study like I did in part 2? Please don't, okay? So you will only go to the guideline to clear a point of confusion if you do have, okay? Or in a structured discussion, for example, you've been asked by the examiner about the time of delivery for a patient with a placenta previa, okay, without symptoms. Then I'm not sure, oh my God, it was 38 weeks, no, 37 weeks, maybe 36, so I'm not sure. Go to the guideline or go to your study notes in part 2, okay, just to confirm this little bit of the information, right? If there is one new guideline, for example, last one, nausea and vomiting in pregnancy, okay, yes, read it, okay? Like, for example, for the intrapartum care, read it, something like that, okay? So read the updated guidelines that you didn't cover in part 2, okay? Only go to the guidelines if you feel a doubt about a piece of information. Other than that, again, this is not a theory exam, okay? So, recalls. Okay, Dr. Rabah, we know you from part 1 and part 2, and you don't really rely too much on recalls in your course. Yes, I'll say that. Again, for the part 3, recalls are very important, okay? But I can't rely 100% on recalls, but I must practice recall for the part 3. Why? Simply, my friends, if you do have 14 tasks in the exam, okay, from my experience with so many exams in the previous batch that I was honored, to guide them for the exam, I found that people get sometimes all 14 tasks based on recalls, or sometimes 13 tasks based on recalls, one new task, or if the exam is so much updated and new, this will be like 12 tasks came based on the recalls and 2 only new. Okay, so I never seen something different than this. So from the experience, okay, recalls are very important. Okay, so I have seen some ready template recalls or ready-made recalls template in the Telegram group or whatever group, okay? Shall I depend on templates? Please don't, okay? Why please don't? Because examiners are so sensitive for that. Guys, I'll tell you something. I do have a case, for example, and this case is diabetic with poor control in pregnancy. So I know that this is one of the recalls, right? When I go to the task, when I go to the cubicle, okay, in front of the role player, shall I go as per the template or should I go naturally? Okay, it's please go naturally. Okay, sometimes simply the questions from the role player is different from what you have seen, right, in the template. Sometimes people are so keen to apply the templates, even they don't listen correctly to the role player, so they fail the exam. They come out from the exam and they said, oh, I know all the cases. It's 14 tasks of the recalls. I have studied them all and I know the template very well. But simply, result come out and this person failed in both communication and patient safety. So my God, what is this? Yes, this is because you were just keen on applying or completing the template. You didn't listen to the role player. You didn't communicate correctly with the role player. You didn't answer all the questions of the role player, so you failed. Okay, so guys, don't rely on that. Just know the case, okay? And practice by your own way. Okay, guys? Please do that. Practice books. Yes, do it. 100% to go for it. Okay, so the practice books that I would recommend that you cover, okay, starting from the very important book of Lisa. This is the book number 1, and I think this is the book when you received the success letter from the RCOG congratulating you for the magnificent success in part 2. They also advise some resources to study for the part 3. One of these resources is the Lisa Jewell book. Okay, so some people say that this is a Bible for part 3. So yes, I really agree, 100% agree. Please prepare yourself from Lisa's book at the beginning. Read every word and apply it in your exam. Simple, okay? It's a small book, very nice, very concise, and it explains from the examiner point of view what is expected in a task. And the most beautiful thing about this book is that there is videos, okay? And you will find those videos in our group, okay? If you want to buy it from online, you can do it. However, it's available in the group if you want to watch it. I think there are 8 videos. 8 videos based on 4 cases, 4 tasks. Each task, they show you 2 examples. One example of past candidate, one example of a candidate who didn't do it correctly, okay? And you will find in the explanation of Dr. Lisa, this is, as I told you, a very beautiful explanation why this candidate have failed, okay? So you will get into the mind of the examiner. Can you imagine that? Okay, so that's very, very important resource. And I find people, I'm sorry to say, okay, they rely on, for example, one course material, okay? Or they try to get other candidates who passed, they try to get their notes, their handwriting notes, and they rely on that. Okay, can you imagine that? And they don't rely on the official resources that written by examiners. Okay, and by examiners, I don't mean just only assessors, people who just, write assessment of the candidate in the exam. No, I mean those examiners in the exam committee who write your exam. Those are the people who, guys, design your exam. So you have to listen to them, you have to follow the college advice, and you have to start with the Lisa book. That's very important. Okay, so step one, Lisa book. Okay, study it from cover to cover along with watching video, and you will see in the comment section, okay, it's the last part of that book. Okay, you will see the comments of each one of each candidate. So for example, here, my friends, I'll show you 1 second. I'll share this with you. Okay, so you can, guys, imagine that. Can you see? After you watch the video, okay, you will find, for example, in video number 1, the clinical examiner comments, okay, and for the information gathering, he give the candidate borderline. For the communication with patient, borderline. For patient safety, pass. For applied clinical knowledge, borderline. Okay? Then in video number 1, what was the lay examiner comments? Information gathering, failed. Okay? And in communication with patient, failed. Can you see how the lay examiner can affect your performance? Yes. And your overall marking, yes, it is. Okay, so please study the book. Okay, and this, we are going to practice this book in our practice group, in the public practice group, and also you can watch the videos. It's very important and essential part of your preparation. Okay, so another book is Get Through. And by the way, in this book, there is one full circuit along with the videos and advices. Get Through, it has 2 full circuits. That means 28 tasks. Okay, very important, and cases comes from those books. Number 3 is the Oxford book. Okay, and it's a very important book written by examiners. As I told you, it contains around 100 tasks, and the 100 tasks all important for exam, and they appear in the exam. Okay, with, again, the examiner comments. To be honest, I see that the valuable feedback in Lisa book is the best, followed by Get Through. Okay, Oxford, not all the cases have a good explanation according who is the author. of this explanation, but the cases itself are important, of course. Then we find last book is Kunji book. Kunji book has a good collection of recalls. Okay, so you can go also to the Kunji book and practice tasks from there. Some tasks are outdated or not used anymore in the exam, but no problem based on the old format before 216, but still you can practice the role player task from the Kunji book, it's fine. So if I want to practice books, I will go Lisa first, get through second, Oxford third, and Oxford is the largest. And lastly, if I have time, I will go for Kunji. Okay? If you finish the 4, there are old books, maybe you can practice them, so it will be good. Okay, so how shall I study or prepare myself other than practicing tasks from books? Very important, my friends, that you follow the patient information leaflets. Okay, patient information leaflets are important to read if you are preparing for the part 3 freshly. Why? Or if you have attempted the part 3 before and you didn't pass, okay, with problems of using medical jargons, for example. Why patient information leaflets are important? Because you will find examples on the RCOG website, and they are available for free for information that a woman should have or should know. I'm sorry for the patient should know about her condition. For example, a woman with a small child, small for gestational age. Okay, so how to counsel her in easy language understandable by the role player. Okay. Then also you need to avoid the jargon, okay? And you need to use the RCOG glossary of medical terms. The RCOG glossary of the medical terms are also available for free, okay? That's a very important part that you go and see. So for example, you will go and you will find this like a dictionary of the layman terms or how to explain easily the medical language to the lay role player. And of course, there will be one lay examiner to listen to you. So they will write their own notes for your using language. So for example, you will find that abdomen, okay, is a jargon, and you should use, for example, the tummy, okay, instead of abdomen, okay? When you use, for example, you want to explain fibrosis, okay? So you will say that the tissue healed by scar tissue formation, okay? So the scar tissue instead of fibrosis, okay, or fibrous tissue. You want to explain uterus, so say womb instead of uterus, okay? So you have to familiarize yourself with the medical terms and the explanation to the lay person, okay? Okay, my friends, so now this is the last part. However, I should have, commented on that at the beginning, but I will speak more now about the exam, okay? About the exam of self. So the exam itself, it's focus on assessment of 5 domains. Number 1 is patient safety. Number 2 is communication with patient and relatives. Number 3 is communication with colleague. Number 4, information gathering. And number 5 is applied clinical knowledge. You have to pass, okay, the domains in order to pass the exam. However, sometimes you receive a letter, people receive a letter with, for example, if the pass mark is 64 and they achieved 66, okay, they will receive like this. Some people receive like this, that you have congratulations that you have passed the MRCOG Part 3 exam, and now you are eligible to be MRCOG. You have scored 66, and then they will give you details of your result, and in that detail you find that didn't reach a standard for in one of the domains, for example. It doesn't matter. Okay, so it doesn't matter. You don't need to pass the 5 domains in order to pass the exam. You have to reach the standard in scoring, okay? And sometimes deficiencies occur in 1 or 2 of the domains, okay? But of course, that's mean you have performed very well in the other domains. That's why you passed the exam, okay? So if you have received something like this, it's fine, you still pass the exam. Types of the task that comes to you, we have two types of task. One is a structured discussion and one is a simulated patient or colleague task. Usually you will have 9 tasks with a role player in them, okay? The role player is acting as a patient or patient relative, like husband, for example, and you have to speak with layman terms. Some of these stations, you will have examiner, clinical examiner and lay examiners. Some you will have only a clinical examiner observing you, watching your performance and write down a feedback, okay? The structured discussion task, those are usually 5 tasks, and the 5 tasks in the structured discussion, those 5 tasks will be with examiners. One of them could be with a colleague, a junior colleague, which is a teaching task, okay? So here it's all based on your information. However, it comes as a part of the obstetrician Got Talent, okay, on that day. And the examiner will play a role. For example, I am your clinical supervisor, and I'm here to discuss with you management of case that you have seen yesterday. And then he will start discussion of a case about Miss ABC, for example, who came with severe bleeding, and he will start asking you question based on this case. Okay, like other oral exams, but it's not exactly oral exam. It's called the structured discussion because you have to follow the structure of answer based on the RCOG recommendation. Okay, so this is the types of the task. And here I would like to show you, my friends, how it look like in a station. In this station here, number 1, the examiner is there. Can you see the examiner? This lady sitting there. And this is the candidate, okay? And this is your colleague, okay? Simulated colleague task. And apparently this is a station to teach practical skill. Could be a shoulder dystocia, for example, could be something like delivery, okay? Vacuum delivery, okay? So here the examiner is sitting there, never interact with you, just write the comments and mark you down. This is another example, number 2, of a structured discussion, which is with examiner. This is the examiner sitting there, and this is the candidate, okay? So 2 persons only inside the room. Here is a role player station with lay examiner. What is a lay examiner? A lay examiner or a lay person is somebody who have no medical background. This person is sitting there to watch your communication and assess whether simply you are a good doctor that they would like to have in the community or you're not. Okay, so you have to prove yourself, my friends, that you are a good and safe doctor who can communicate nicely with the role player. So one of them will be the lay examiner. One of them is the clinical examiners. Both take notes. You don't have to interact with any one of them. And this is the candidate here. And this is the role player there who's acting, as you can see. Right, my friends? So this is the example of task, 3 different examples, okay? Sometimes, as I told you, you will not find the lay examiners, okay, sitting there, but you will find only the clinical examiner. Okay, is it clear so far? Let's see, my friends, again. This is the online exam, and I have heard that some of the candidates who have reasons, like for political reason, okay, they can't travel outside their country to attend the exam. So the college allow them to sit online exam, okay? So the online exam is back again, but for special cases, not for everyone. If you think that you are a person that have this selection criteria, you know, of the online exam, please contact the college, okay, and ask them to arrange for you an online exam if it is so difficult to attend the face-to-face exam or the live one. The online exam will be run by what's called the Osler system, and the Osler system is a system which developed by the role players themselves during the COVID time, actually. I think that they have found themselves like free of work. They don't have work to do, so they have decided to develop this application, okay, the Osler system, and the college have used this for like almost 3 years. Okay. Thank you very much, my friends, okay, for your time and attending this with me today. Thank you. Thank you very much. I would like to thank you all for your time, for listening, okay? And hopefully that you found that this meeting is useful for you guys. And I would like to announce a very important announcement about my friends who are just passed their part 2. So again, congratulations. This is a gift from the MRCOG, eMRCOG team. And this gift is a free course for essentials of the part 3. This course is well designed, okay, to help you, my friends, kickstart your part 3 preparation, okay? And you will understand deeply, or you understand more about the part 3 and about the requirement in part 3, type of task in part 3, and also we are going to practice communication skills, information gathering, and difficult communication station like breaking bad news, like angry husband or angry patient, how to deal with a demanding patient also scenario, and some special task like labor word and gynae list with some tricky recalls. So hopefully that this course is useful for you guys. This will be a 7 sessions course, okay? So the time and the details of the course will be shared in our practice group, the Telegram group. So you can click the link below and you can fill the form, okay, for the part 3 essential course, the free one, and you're welcome everybody to attend. Thank you very much again, and goodbye.